Welcome back. It's 6:45 on a Monday morning. As we've been reporting, Erie County vaccination appointments have been canceled for today, tomorrow, and Wednesday because of a dramatic reduction in vaccine allocation. But even when vaccine is in stock throughout the area, it's limited, and there are many problems making an appointment to get that shot. This morning, we're going in depth with Christine Schuyler, the Director of Health and Human Services in Chautauqua County. She says it doesn't have to be problematic, this rollout of the COVID-19 vaccine, but because county health departments have plans for mass vaccination that have been shelved by New York State, she says the state is taking authority for vaccine distribution away from local health departments, which is slowing things down.
Yeah, this has been a very challenging time for local health departments. Our staff is maxed out. We're doing everything we can with isolation and quarantine and really doing the communicable disease work we're mandated to do. And then we were poised to do vaccination, which is much more in our comfort zone and what we're used to doing. And then those plans were shelved. And here we are questioning why the vaccine is being rolled out so slowly. It didn't have to be this way.
Shelved, you mean by Albany, the governor?
Yes, the state, whoever that may be.
Okay, so let's put this into perspective. Local county health departments have plans for mass vaccination. There are plans in place that you, as the county, Chautauqua County, developed to make sure that people in this horrible situation are able to be vaccinated on a big level. Those plans have been shelved by New York State. New York State basically saying, actually, Chautauqua County, actually, Erie County, we got this. We'll handle this. What do you make of that?
Local health departments across the state have felt that we were slapped and that really our plans were shelved. And it really didn't make any sense to us. We felt disrespected by the state, and I'm not saying state health department, because we are very fortunate in Western New York that we do have a regional state health department office under Dr. Greg Young, and they are phenomenal to work with. They're hugely supportive. They've done an excellent job, but they really have not had any part to play in the state's rollout of vaccine and their response to COVID-19.
Do you think so much of the blame falls on New York State, falls on the governor, falls on Albany, because had the authority been given to local health departments, this situation would have been handled much differently?
I feel that the entire pandemic could have been handled better with better communication and better collaboration with county health departments. We had plans in place. We've drilled for these exercises. We know what to do. We know the sites to be used and how to set them up and how to get vaccine in arms. And that's what we should have been relied upon to do. And that's what our community expects from us. They expect us to be the leaders out there. That's why our phones are ringing off the walls and our emails are blown up and everybody is so frustrated because they are looking to us for answers and we don't have them. Collaboration, communication, partnership is what we need. Being very heavy-handed and dictate after dictate is not the way that you get things done.
So public health really has been left out of the equation here, it seems. Why is that?
I don't know why that is, but for some reason in New York, that seems to be what the case has been. I do feel that is changing now. With the regional vaccination network hubs, have realized the importance of the local health departments in their regions and have escalated our concerns and also given us a bigger voice with the governor's office as far as what our capabilities are and what we can and should be doing for our communities. So I'm hoping to see a larger amount of vaccine coming to local health departments so that we can that will enable us to really do some larger vaccination pods for our communities.
So what should be done at this point? And you kind of alluded to it. It sounds like more vaccine may be coming to local health departments, or local health departments may be brought into the mix a little bit more.
I feel that there needs to be more coordination at the county level because that's what we know how to do. We know our communities, we know our partners, we know how to do the job that needs to be done. And that coordination, I think, is best done at the county level. And that way we would actually be able to answer our constituents' questions. We could take care of our residents and push the vaccine out like it needs to be pushed out.
Christine, thank you very much. I appreciate your time this morning. So we have reached out to the governor's office for more information, and for a comment we are yet to hear back. You can find so much more information about this vaccine rollout and our guide to help you get an appointment right now on WKBW.com. Skylar was saying that public health officials have not been recognized nor empowered because the state has decided the scope of this pandemic was so much more than what those county level plans could manage, despite the fact that they drill for this, they plan for this, and they were frankly ready for this vaccination effort, is what Skylar says, and the state is just not allowing them to do so much, Katie. So it's really frustrating for so many people.